living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
You're not alone if you've experienced back pain at some point. In fact, about 80% of adults will experience back pain in their lives. So what can you do to avoid it or lessen the pain and stay spine healthy? You won't want to miss this week's show because we're going to focus on back and spine health. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Lisa Sather. Stay tuned. Welcome back to Healthy Living for Life. Our first guest is Trapper Hogberg, who specializes in orthopedic spine surgery. Welcome to our show, Trapper.
Thanks for having me.
Thank you. So can you start by giving us a breakdown of the different bones and tissues that make up the spine?
Sure. Well, the vertebrae, or the back, is made up of 30 separate bones, and they're all kind of stacked on top of each other, and they connect our pelvic girdle to our head. In between each one of these vertebrae are vertebral discs, which act as soft cushions that kind of cushion the bones, keep them from rubbing against each other. And then there's a bunch of tissues and ligaments that kind of connect everything together.
Perfect. So I know lower back pain is a common problem for adults, and especially for those over the age of 50. So what happens as we get older that leads to the propensity towards that?
Well, as we get older, the discs tend to degenerate over time. You lose a lot of moisture in them. They get quite dehydrated. And over time, these shrink down and cause the bones to start rubbing against each other. And this can start to give you early arthritis in the back or deterioration, causing quite a bit of back pain.
Mm-hmm. And so how about talking about why the lower back is usually a more common area where people have spine pain than other areas?
Yeah, the lower back is what carries most of the weight from our upper body. If you look at all of our upper mass goes through the lower back, and that's where most of the weight is distributed on our lower back. There's a lot of movement in this area as well, and tends to be a higher area of friction, which can cause more pain over time.
Makes complete sense. And I've heard, people talk about losing height or shrinking as they get older. What makes this happen to folks?
Yeah, like we talked about, the discs are actually, when we're younger, nice pliable shock absorbers, and as we get older, they lose quite a bit of moisture, which causes these discs to shrink down. And that, with the bones now rubbing on top of each other, will actually shrink down over time. It's not uncommon for an adult in their 70s to lose 2 inches of height.
Wow, that's amazing. So how about people that are overweight? Are they more likely to experience back pain?
Absolutely. The more weight that you have in your upper body, the more pressure is generated on that lower back, which can cause excessive pain. And especially having more mass in the front, it kind of changes the way your posture is. It causes you to lean forward more. And not only does it place more stress on the spine and the bones, but also on the muscles as well, trying to hold your posture upright.
That makes sense. So for those of us who sit at a desk a lot and maybe tend toward poor posture, is that something that can lead to back problems? Absolutely.
Poor posture is one of the leading causes of back pain for sedentary people. The leaning forward throughout the day with poor posture causes the muscles to kind of not do their job. It can also cause the vertebrae to not align in the way that they should. I often find myself slouching and needing to take constant breaks just because of this.
So sitting for long periods of time, you'd recommend doing just that then?
Yes, frequent breaks, stretching, standing up, changing positions, and also kind of trying to concentrate on the posture will help.
That makes sense. So how about wearing shoes that don't quite fit right or that are worn down? We hear about that. Is that an issue for causing back pain?
Absolutely. A lot of back pain can be caused from ill-fitting shoes, especially in the summertime. Flip-flops don't offer you the cushion or the amount of, nice cushion that you get with them. It tends to put more pressure on the back. It can also adjust the way that you walk. I always say that if you build a foundation crooked, the rest of your house is going to go up crooked as well. So good fitting shoes with good padding can certainly help alleviate some back pain. If you notice that you're having back pain and you say, hey, I just got this new pair of shoes, maybe try switching up the shoes and see if the back pain goes away.
That's good advice. So what about insoles? You know, buying special insoles or arch supports for shoes, is that recommended?
Absolutely. Insoles, again, offer that nice amount of cushion that can alleviate some of the shock. And then insoles can actually help the way we distribute weight on our feet. These can also help out with our posture and the way that we stand. You know, if you are noticing that you're having back pain and foot pain, or you've recently changed shoes, you can always go see your podiatrist or your physician and see if you guys can figure out if that's a common cause.
That's great advice. So we've talked about sitting for long periods of time. What about standing for long periods of time? You know, standing stationary, just standing, is that an issue for back pain?
Absolutely. That's all the weight that you have being placed on that lower back. Standing for long periods of time, much like sitting, especially workers that are working with their hands bent over, slouching as they're sitting, that can cause quite a bit of pain as well. Well-fitting shoes can also help out with this as well. Some of the harder shoes can certainly not absorb as much shock and place quite a bit more pressure on the back.
So I'd assume same recommendation goes with sitting for long periods of time. If you're just going to be standing, maybe even is moving effective too, just to be moving around, doing some walking?
Absolutely.
That's something you'd recommend to keep people?
Frequent breaks if you can, stretching, and then trying to walk around, or even, you know, just change your posture a little bit.
Perfect. Awesome. Well, we're going to take a quick break, so we'll be back in a couple of minutes to finish our conversation. Thank you for all the information thus far.
Thanks.
Up next, we're going to talk about some common back issues and how to treat them. We'll be right here after these messages. Stay tuned.